Hello, I'm Dr. Amiya Prasad. I'm a cosmetic, oculofacial, plastic, and reconstructive surgeon practicing in Manhattan's Upper East Side and Garden City, Long Island. I'm also boarded by the American Board of Cosmetic Surgery in facial cosmetic surgery. In my practice, I specialize in eyelid and facelift rejuvenation procedures. And today I'm answering questions from realself.com. And this question is about facelifts. The question goes as follows. The difference between traditional facelifts depending on the surgeon. My husband had a face and neck lift 3 days ago. He wore a thick bandage with drains for 2 days, took anti-inflammatory and antibiotics. His face is very swollen and he is asked to sleep on his back for a month. My sister is having the same procedure in Paris, but tells me she won't even stay overnight. She plans to rest at home for a few days and start work after 7 days. Her doctor says she can sleep on her side, no problem. Same procedure. Why the difference? Asking because I'm scheduled for the same. This is a common question we get in our practice. I spent my entire career of 16 years in practice developing quicker recovery procedures that look more natural. And so, interestingly, that you're experiencing this contrast because you're dealing with essentially the same goal. The goal of a facelift is to lift the cheeks, improve the jawline, improve the neck. That's the ultimate goal. And what I discovered when I was in training, that a lot of our plastic surgeons who are more traditionally trained would do the type of procedure that you described in the first part of your question, which would have included being under general anesthesia, having a lot of trauma to the area, which results in a lot of swelling, and that required bandages and drains and all these things. I asked a different set of questions when I went into practice and during my training, and I decided that a lot of things that made sense to me to help my patients recover quickly and at the same time no way compromise the quality and longevity of the procedure. There's a little bit of a myth in the field of plastic and cosmetic surgery that the harder you work or the more you do or the deeper you go, that you'll get a better result. There is balance, there is finesse, and there is certainly an art to choosing the right procedure for the right patient. I would say that in my practice, the experience is more like what your sister described of having the procedure in Paris. In my practice, the facelift is done under local anesthesia with light IV sedation, which is like Twilight. We don't use drains. We have a light facial bandage placed, and they go home. And it's interesting. A lot of people don't believe me when I describe it, and our patients are back to work and back to normal life in a week. I think that you can make an argument for both procedures, but my bias is towards the Parisian doctor following the same philosophy because we can still get excellent results, long-lasting results, and help people look better faster, and in my opinion look better and more natural. So continue doing your research, and you certainly will find that there is slowly a growing number of people in my specialty, particularly in the cosmetic surgery field, who are trained specifically in facial cosmetic surgery, who will be doing this procedure under local anesthesia and light IV sedation. And I describe this actually in my book, The Fine Art of Looking Younger, so that within the normal lifestyle or the way people live these days, prolonged recovery is just not practical and not desirable. So you can certainly take this information and continue doing your research, and I hope that was helpful. Good luck.